Okay, so hello everyone, and welcome to Breakout Room 2, Careers in Medicine. So this breakout room rotation will run about 35 minutes, but I think it's going to be a little shorter because of the technical difficulty, so I apologize for that. My name is May, and I will be the staff assistant for this room. And before we begin, just some things to keep in mind. Each of our speakers are going to present briefly, and then we'll open up the conversation. When we open up the conversation, if you have any questions, feel free to use the chat function or just raise your hand to come off of mute. And because this is a conversation, we do encourage you to speak directly with these amazing speakers. But anytime that there's not really any questions, I will come in because I'm curious about a couple of things as well. And so please stay on mute when you're not speaking so everyone can hear. And for our panelists, I'm going to indicate when there's 5 minutes left in the session. And so I'm so excited to introduce our breakout room speakers today. We have Dr. Adrienne Burrows in the internal medicine physician program. She completed college and medical school at Howard University in Washington, D.C., and she completed her residency and postgraduate training at Huntington Memorial Hospital in Pasadena and USC. And Dr. Burrows worked as a clinician and medical director of multiple federal qualified health centers treating low-income, impoverished, and houseless individuals. And Dr. Burrows opened her private medical office in Santa Monica, where she now practices as well. We also have Dr. Jessica Bodden here with us. She is a resident physician and a South LA native. She completed her undergraduate studies in molecular biology at CSU Dominguez Hills and her medical training within the CDU UCLA Medical Education Program. And she is a third-year psychiatry resident at the UCLA Resnick Neuropsychiatric Hospital. And then we have Dr. Audrina Vong, who is a doctor of physical therapy. Dr. Vong earned her BS in Child and Adolescent Development from CSU Fullerton. She went on to earn her doctorate in physical therapy with a focus on pediatric rehabilitation from Cleveland State University. And Dr. Vong specializes in hematological diagnoses with an emphasis in refractory and relapse disease. And over the course of her 7-year tenure at the City of Hope, she has collaborated on various research studies focusing on rehabilitation for the geriatric population. Okay, so I want to turn it all to you. And if you have any questions, feel free to put it in the chat or raise your hand. Okay, so I'm going to start us off. What project are you most proud of? Or what undertaking in life are you the most proud of?
So Dr. Vong here. I'll say when I did practice out in Ohio every week, I would volunteer at what we called the free clinic, which was in downtown Cleveland, a population that, doesn't visit primary care physicians, doesn't get follow-up checkups, but every Wednesday from 6 to 10 o'clock, we saw patients for free. Whoever came in, we would treat anything that they had questions or concerns about. And that was always so fun because it was pro bono, so no pay. These patients paid nothing out of their pocket. They got to see, we had a physician, we had a psychiatrist, we had a physical therapist, we had various medical professionals at this clinic, and they could literally go door to door and have their concerns, questions answered. And it had been decades that a lot of these patients or individuals had been seen by any sort of medical professional. So that was really filled my bucket every single week. And that's probably the thing I am most proud of. And I'm really working hard to bring that over here into Southern California, and LA area would be fantastic.
I can go next. So something I was really grateful that I was able to participate in was collaborating with the California Black Women's Health Project. And so I specifically work with him on a project called Sisters Mentally Mobilized, which sought to create like sister circles for Black women living in Los Angeles. And the goal really was to just help them to kind of take off the Superwoman cape. It taught them about how to address like mental health stigma, basic information about mental health. And the goal was to really empower them to become advocates in their community. And so that was something that similar to like Dr. Vong, like it really filled my bucket. It was something that continued to encourage me to I'm doing good work, that I love community-based interventions. And so it was just something that I was really grateful to have worked with them for the short time that I did. So yeah, it's me.
Hi, everyone. So I'll end the query by saying the project that I'm most proud of is the project of myself as a healthcare professional, because there is no one single thing that I'm most proud of, because things happen and evolve. I've been in medicine now for probably at least 30 years, and there's so many things that have come and gone and evolved, but I'm still here and I'm still evolving. So one of the things I'd like to impart to those of you that are coming along, whether it's to come into medicine or physical therapy or any other allied health profession, is to develop good habits. And you may not feel like these habits are important on a day-to-day basis, but by developing these good habits, when you know that you've impacted somebody's life because of who you are as a person and as a clinician. And I'll share with you a brief anecdote or story, is that a patient come through my office in my private practice here a couple of years ago, and I could hear the ruckus at the front counter with this very exuberant person saying, "Oh my God, I found her. I'm so glad I'm here." And I come out, and it's a patient that I saw maybe over a decade earlier, whom I didn't even remember, to be perfectly honest, at first. And the patient said that she had been looking for me for about a decade because of an experience she had had with me, and my psychiatric colleague can probably empathize with this, where I saw her at the end of the day working at a clinic, and I don't remember what her underlying health need was, but I saw that she was in mental distress, and I'm not a psychiatrist. And I told her that I felt she needed to go to an emergency psychiatric setting right then and there. And she said, "No, I can't. I don't have the money. I don't have the resources, I'm just going to leave your office." And I stayed with her and assisted her in getting a taxi to the nearest, back then there was taxis, to the nearest emergency room. Well, when this lady found me several years later, she was impassioned to say that I had saved her life. Because I even gave her $10 during that visit, which I've never done before, because I really wanted her to get to an emergency room. And she exclaimed that I had saved her life because she had actually planned and was seriously had the intent to kill herself that day when she left our office. And instead, she went to an emergency room setting and got the psychiatric care that she needed. And so that's one of the things I'm most proud of, because by doing this with every single person, by being compassionate and being detail oriented. So this was not my patient. She was not on my schedule, but I was the one that stuck around. And that wasn't just with her, but it's been with many patients. And that's who you want to be, is that person that you never know how you're impacting someone's life. I might have thought I was treating her cold, but instead she felt I was saving her life. And when you do this every day, you may not see that, you may not know that, but if you know that you're doing your best in doing that, trust me, you will be having several opportunities to be proud of yourself as the project.
Thank you. We have a question from the audience, and so it's in the chat, and so I'll read it. How do you see the role of generative and analytical AI, as well as robotics, expanding in medical field careers? How should people incorporate this into their careers as the technology matures and improves? And this was from Samuel.
That's a great question. I know when I started my whole journey here, everything was pen and paper, right? So we'd have to get a chart from each patient and document in that chart, which was very time consuming, which wasn't efficient at all. So with the development of just technology in general, now we have paper charting, right? We have PMI, all this great stuff, which can also, lend its way to barriers and infiltration, which is scary with all our personal medical information out there. From a physical therapist, we're very hands-on. I don't think it's ever going to replace the need to have hands-on care, which is great, but it has really enhanced follow through and education on the patient side. So I can develop a whole program for a patient and actually send it, email, text, whatever the case may be. So they have a visual of what they're supposed to be following daily. So it's a nice education, a nice reminder, a nice resource for these patients. But that's my perspective as a physical therapist.
And great answer from Dr. Vong. And like I said, I'm a little older probably than Dr. Vong. I don't know if you remember something called micromedics, but that was even pre-internet, so that's how long I've been practicing now, pre-internet, believe it or not, and as we progress technologically, AI and all the things to come, what I will say most is that who knows what tomorrow holds. Medicine is a much different animal than it was prior to these technologies, and it's still only going to progress in that direction. So this is where those of you coming along now have the greatest opportunity to not work for medicine, but to make medicine work for you and to be a part of cultivating how we use these new technologies in healthcare and in practice. And if you remember our panelists at the beginning, such as Dr. Carlisle, to get involved with using these technologies from the public health perspective to overall enhance, but not to replace that human to human contact.
And then Dr. Bodden, did you want to touch on that, or should we move? Oh, we have another question. But did you want to touch on that, or we're good?
No, I think it was answered beautifully by
Okay,
Dr.
awesome. So Bianca asked, in times of adversity during your graduate school journeys, what kept you most grounded?
I can answer. So, like my intro said, I am from the South Los Angeles area, specifically from Watts. It is a community that is very tight-knit. So many of our parents went to school together. As much as like we went to school together, like it's just like a very strong community. And so I felt like during times where I experienced adversity, or just challenges in medical school, what has really kept me grounded was the realization that I was lucky enough to be able to do my medical school training in my community. And then my community itself, they definitely poured into me. They're like, Jessica, you're doing a great job. Keep going forward. And so I was really able to pull from that to continue to fill my cup so that I can continue to move forward. So my community was super, super important.
Great answer, Dr. Bodden. I was propelled by, I had student loans. So once you get as far as medical school or graduate school, if you are not fortunate enough to have had that funded for you either by, your own finances or scholarships or grants, after your first year of medical school, you're kind of in it to win it because, there's not a lot of other professions that will help repay those student loans that you've already invested. But also, knowing that you have what it takes or you wouldn't have gotten that far. My husband happens to be an attorney and we both went to the same university, and he was in law school at the same time that I was in medical school. And at his law school orientation, they said, look to the left of you and look to the right of you. And by the time you finish, one of you will not be here. That's what they told them in law school. In medical school, they said, look to the left of you, look to the right of you. And when you finish, we expect you all, or most all of you, to be here. And so when you go into allied health, the understanding is that they're not taking a chance, they're taking a probability that you will be great at what you do. So if they already had the faith to accept you into whatever programs you may enter, then it's done. They already know that you have it. You just have to believe that you have it.
Oh, that's great. For me, this was actually asked in the previous session. It was really my family that propelled me. I was the first person to attend any sort of graduate work in my family, the only medical professional in my family. In my graduating class, I was the only Mexican in our graduating class, the only Spanish-speaking individual in our class. So I felt a huge responsibility to follow through and be successful, to be an advocate for those non-Spanish speakers, for those females, for those minorities, specifically Latinas. So it was kind of community-based, like Dr. Bodden had stated, and exactly like Dr. Burrows has stated, for myself, believing in myself, believing that I can be an advocate for these communities. But that was a huge driving force.
Okay, awesome. And then I think we have another question. Beyond the medical degree, what training or certifications would you recommend for someone getting into a medical career to assist with getting a job at a reputable hospital or company?
Well, in terms of getting a medical degree, obviously, first and foremost, you want to get the medical degree. And, from there, what's great about medicine is that, and being a doctor particularly, is that once you are a doctor, you are always a doctor. In some professions, if you are trained as a banker, you're a banker, but then if you go work at Starbucks, you're a barista, but once you're a doctor, you're always a doctor. So it is your career, and it is something that you get to define and carve out, whether it's going on to be something in academics or going on to being something in public health, going on to do something different altogether. You're still a doctor. And thus you can, it goes back to what I might have said in a previous session about your passions find you, and those passions can be infinite. So I had medical school or residency colleagues who were lawyers, either before or after. One of my best friends in residency, he had been a lawyer. He had become a doctor, and unfortunately, he passed away during our residency. But his joke was that when I finish medical school, I'm going to go get my master's in business. So you can do so many things now, and with the advent of AI, which the question asked earlier, to have the opportunity to combine and mold and morph all of these different things, it really is sky's the limit. But traditionally, having experiences in research or masters in public health, all of these things were traditionally valuable or invaluable. But these days, I believe that what businesses and hospitals and programs are looking for are well-rounded individuals that are mostly successful and passionate about whatever it is that they're doing. So if you're a dancer and you want to go to college and dance, as one of my best friends wanted to do, but her parents wouldn't let her because they wanted her to be a doctor, and she did too, dance. You can still go to medical school. If you like film, go study film, and you can still go to medical school. But just as our speaker said in a previous session, or as Dr. Carlisle or one of the other panelists said, whatever you do, do it well and do it your best, most of all.
And just to add, this is a really great time to, find folks who are doing things that you ultimately want to do, and like see if you can sit down with them for a couple of minutes to just ask them, how did they get to this point in their career? What were some of the challenges? What were some of the things that they enjoyed? What experiences did they do in order to get to where they are in their life? So I would say, do exploratory interviews. That's something that I did. Like I spoke to residents, I spoke to medical students, attendings, fellows, whomever, because ultimately I had a really clear idea in terms of I wanted to be a psychiatry resident, or not a psychiatrist, I wanted to be a psychiatrist, and I needed to know what I could do to actually increase the likelihood of that actually happening. So definitely reach out to folks.
Yeah, spot on with both of those. As far as physical therapy is concerned, we kind of touched a little bit where you have certain rotations, and within those rotations, you kind of figure out what you really like, and maybe you can pursue a little bit more shadowing in that area, or a specialization. So we do have oncology specialists, in physical therapy. I know when I interview people and I want them to come on board, I love those who have pursued a passion, who are community outreach, who have projects under their belt, not necessarily $4 million grants, but things that they are really passionate about. So I would say pursuing something within your profession, but also out a little bit. Like Dr. Burrow said, somebody who's well-rounded, who is really passionate about helping the community, about helping the patient population. So it's endless, and it's continually evolving. There's not one right track to take, I would say.
Amazing. Does anyone have any questions? Okay, if not, what things do you find challenging and what things do you find particularly rewarding about your job?
Okay. I think we're all on board when we talk about insurance. Insurance is incredibly challenging. It's incredibly difficult to navigate. It changes all the time. I don't think it serves everybody equally. You know, if I could treat everybody without the worry of insurance, which we're supposed to do, which we do, but you know, there's organizations and there's politics that are involved. I think I'd be a much happier therapist, and I'm a happy therapist, you know. But that's probably the most challenging. The greatest thing I do is treating individuals every single day. It's having face-to-face conversations that, you know, hopefully are directed towards physical therapy, but a lot of time it has to do with just sitting and listening to what their concerns are. That's when you really get to know a person and when you can provide the best care for that person. So for me, it's day-to-day contact with patients, individuals, really feeling like you're listening and you're helping, and they walk away a little bit lighter, right, with a burden lifted, almost because they were able to verbalize their concerns, their needs. So that's what keeps me going.
I'll jump in second. I actually made a little bullet list before this talk because I love this question. And pardon me and our coordinators if I'm a little too blunt and honest, but I think the audience deserves that. One of the things I like about my profession as an internal medicine physician is that, you know, I have a certain amount of autonomy in what I do and how I do it. You know, I get to choose a little bit, you know, this season in my career, I want to do outpatient medicine, or maybe next season I want to do hospital medicine, or I want to work 8 to 5, or maybe I want to work 10 to 7, you know. So unlike some professions, I do, and I take for granted that I do have a certain amount of autonomy that comes with my title and my degree. On the other hand, what I don't like is that I don't feel I have enough autonomy now in 2024 as a practicing physician. There's been a huge paradigm shift in medicine in the past, you know, couple of decades, where once upon a time, almost all doctors worked for themselves, you know, and today, most doctors, most of you, if you go to medical school, when you are done, you will work for or with an organization. And with that, you now have managers and supervisors that, you know, can sort of tell you what and how to do it. So I don't like that, because certainly those of us that have gone into allied health, we are a unique breed. You know, we have the patient's best interest at heart, and the mind and the knowledge on how to execute that. Many times that could be thwarted by individuals that are, you know, in a supervisorial position over you now. And with that, you know, that flexibility is something that I like about my profession. However, nowadays, you know, you may see a number of patients that you don't think is conducive to giving the best care, which I don't like. So, you know, and that can be inspired, I'll say, by the insurance companies or the medical groups or the hospitals that you work for. I'm sure my colleagues can understand what I'm saying. You know, I do like that I get to meet a variety of different in internal medicine. I get to meet a broad swath of patients, you know, adult patients, adolescents. I've worked with people all over the Southern California region, from the poorest of the poor on Skid Row to concierge, that is the richest of the rich, you know, in Malibu. So that is great to be able to do that now. As an outpatient physician, I do miss being in the hospital sometimes, you know, and it's more challenging to do both of those things these days in my particular specialization as it once was. I like that as an internal medicine doctor, that I get to continue to be the science geek that I always was, because medicine in the body is endless. So I do like that. And what I really like about what I do today is the electronic medical records and stuff that I nor anybody else ever has to read Dr. Burrow's handwriting again. So I really enjoy that I can type and not write, as should anyone that's ever seen my handwriting.
All righty. And then for me, I think the one thing that I like the most about psychiatry is just how much of a team-based specialty it is. So we work very closely with like case managers, social workers, and all of us are really passionate about the same goal of, trying to provide stability or improve the lives of folks who are living with serious mental illness. And so that's something that I really, really enjoy. And I love to see it work and it be in action and actually lead to an improvement in outcomes for our patients. I think similar to Dr. Vong, one of the things that I am not so much of a fan of is how sometimes our like health disparities exist because it's kind of like built into the systems and the policies in place. And so like an example would be, for some of our patients who have like major depression, who ultimately develop psychotic features, maybe they're hearing voices or seeing things, like our standard of care would be electroconvulsive therapy or ECT, but that might be something that's only accessible to patients who have like private insurance or those who can actually pay out of pocket. Whereas for those who have public insurance like Medicaid, they may not necessarily be able to get access to that. And so by virtue of that, their outcomes are going to be totally different. And we have to figure out how to create creative solutions, even though we know what works. And so that's something that has been a little frustrating, but to that, I try to turn those frustrations into change. And so like I'm really good about reaching out to mentors, figuring out how best we can advocate so that we can try to make some changes at a higher level beyond patient care. So yeah.
Does anyone have any last questions? We have 3 minutes left in the session, so we have time for one last one. Okay, if not, I did have a question, and this is inspired by Dr. Bodden's previous answer about working in like a team-based setting. And so I was curious about the other doctors. Do you work mostly alone or with a team, and how do you like kind of interact with like a more collaborative space versus a more individual one?
I'll start off. So these days I work, well, first of all, you and your patient and your nurses and your assistants are all, as I like to tell patients these days, part of the healthcare team. No longer are doctors paternalistic was the term that we used to use, but the patients are also involved in their healthcare journey. As a private practice physician, I these days work once again primarily by myself. But when I first finished my residency training, I worked at Kaiser. Some of you have heard of it. And it was a great opportunity to work, although as a independent clinician fresh out of residency, it was still very collegial. There were lots of other doctors, not just only in my specialization, but in other specializations. So it was on the job mentoring that really helped boost my confidence, because you're terrified when you first come out of your residencies that, am I ready? Am I really, really ready to fly solo? So Kaiser was a nice opportunity to kind of work alongside yet independently. And the years I was there, really boosted my confidence so that now I'm able to work, in a private setting with the same confidence.
From my perspective, I am in the hospital, so inpatient. So I work with everybody from the nurses, from the patient care teams, physicians, psychiatrists, nutritionists, occupational therapists, speech language. It's very much a collaborative effort. When I go into the patient's room, it is one-on-one. It is me and the patient. But prior to that, there's so much collaboration happening minute by minute, second by second.
Okay, awesome. And so I think we're about to go back to the main room in like a minute or so. Does anyone have any last few minute questions? Okay, if not, oh, there you go. As an oncology patient, oh, that's so sweet. What a sweet message. Okay, I have one question, which is like, what is the biggest piece of advice you would give someone in like one sentence, maybe?
Like Dr. Burrow said, find a mentor no matter where you're at. That is the most important thing you can do when you're first starting your career. Have a facility and organization that would allow you to have somebody to mentor you.
Quickly, this sounds cliche, but remember, you are your superhero. Some of us from Black and Brown communities, especially, we feel that I just learned that term, the imposter syndrome, but we have to remember that we have tools and things that are part of our experiences that make us unique and powerful as future healthcare professionals.
And then lastly, so don't give up, but then also don't forget to give back to the folks who are coming up behind you, is the advice I would give.
Okay, see you all in the main room. Thank you so much.
So everyone else should be back in just a moment.